pada hari ini mengambil keberkatan hari Jumaat penghulu sekali hari ini. Sukacita saya memaklumkan kerajaan akan memperkenalkan Pelan Jana Semula Ekonomi Negara. Pelan Jana Semula Ekonomi Negara atau secara ringkasnya PENJANA dengan tema Bersama Menjana Ekonomi. Di bawah PENJANA ini, kerajaan telah pun mengenal pasti tiga teras utama, iaitu pertama, memperkasakan rakyat, empower people. Keduanya ialah melonjakkan perniagaan, propel businesses. Dan ketiga, merangsang ekonomi, yakni stimulate the economy. Secara keseluruhannya, terdapat 40 inisiatif bernilai 35 bilion ringgit. 35 bilion ringgit di bawah PENJANA ini. Daripada jumlah ini, sebanyak 10 bilion merupakan suntikan fiskal langsung daripada kerajaan.
PENJANA is referred to Pelan Jana Semula Ekonomi Negara, also known as National Economic Recovery Plan, is a short-term economic recovery plan that is initiated by the government within the timeline from June to December 2020. It is a stimulus package that aims to relieve the economic burden that been shouldered by the people and the businesses as a result of dealing with COVID-19 pandemic. To boom the country again during the challenging time, government has taken an approach that includes 6 key steps, also known as 6R, that consists of resolve, resilience, restart, recovery, revitalize, and reform. So PENJANA is a notable policy that government initiated under the 4th phase of rebuilding the country, which are under the recovery phase. PENJANA has a total allocation of budget worth 35 billion ringgit Malaysia to implement all 40 initiatives formulated by the government under the 3 key thrusts, which are empower people, propel businesses, and stimulate the economy. The main goal of PENJANA is to propel the Malaysia's economic growth forward. It is a comprehensive and all-encompassing approach to Malaysia's economic growth, in ensuring that there is a smooth and a swift implementations of all the 40 initiatives. Government has collaborated with other government agencies. PENJANA is a commitment of the government under the leadership of Tan Sri Muhyiddin Yassin to lighten the economic burden that is being faced by the citizen who is in need while facing with the unprecedented pandemic of COVID-19. This discussion will focus more on the first thrust, which is empower the people, where it aims to save jobs and promote employment, while at the same time ensuring that people have enough to live on. So among the 11 initiatives under the first thrust, we take only 3 programs, which are wage subsidy program, reskilling and upskilling program, and PKB40 healthcare support, to be discussed in deep. Wage subsidy program is a continuation program which was first initiated under the budget 2021, and it has now evolved from 1.0 to 5.0. This program provides a financial support to employees for each employee, as it intends to assist employers whose activity have been affected by the COVID-19 pandemic to maintain their operations and to keep their staff who will benefit from the financial security. So to relieve the impact of COVID-19, the wage subsidy program were announced. So under PENJANA, this program have been extended for another 3 months within 600 ringgit per employee subsidy for all eligible employers, with a total of 5.3 billion ringgit Malaysia. This subsidy is noted to benefit almost over 2.7 million workers. as it helps to give employers a source of financial aid to retain their employees. Ministry of Human Resources and Perkesu are among the government agencies that are responsible to cater the implementation of this program. Reskilling and upskilling program has long been introduced by the government in their attempt to be a developed country with a skilled workers and expert in adapting to 4.0 industry revolution that focus more on innovations, digitalizations, and practical learning. So these programs are being enhanced under the Pencana as it aims to increase the employability of the unemployed workers through reskilling and upskilling. So with the emergence of COVID-19 pandemic, it has triggered socio-economic vulnerabilities, and the issues of unemployment are being under the spotlight. So we know that this unprecedented pandemic has left us with impactful downturn, forcing many industry players to shut down their economic activities, and this result to many people losing their jobs overnight. As government aware of the socio-economic vulnerabilities, they enhance this program of upskilling and reskilling to ensure that workers and the youth to maintain or upgrade their skill by the time the economy recovers. This program alone has total allocation budget of 2 billion ringgit Malaysia that will benefit almost 200,000 of youth and unemployed workers. Among the government agencies that involved to cater the implementation of this program are the Ministry of Human Resources, MDAC, HRDF, and many others government agencies. Peka B40 Healthcare Support is a health scheme initiated by the government via the Ministry of Health as a part of government effort to address the growing burdens of non-communicable disease (NCDs). It focuses on reducing the burden of NCD through early screening and treatment, with an objective to expand the access to quality health care. It has 4 benefits under this scheme, which are the health screening, health aid, completing cancer treatment incentive, and transport incentive. Amidst the COVID-19 pandemic, Peka B40 has continued to provide healthcare benefit for Malaysians who need it the most. Therefore, in implementing the Pencana, Peka B40 is included as one of the government initiatives to empower the people and ensuring their livelihood. The objective of this program is to support the healthcare needs of low-income group, specifically the B40 community who age 40 and above, as well as the recipients of the Bantuan Prihatin Rakyat and their registered spouses, with Pencana allocated 50 million ringgit for this program. So Peka B40's lead agency is the Ministry of Health itself, and Protect Health as a company that participating to regulate and mostly handle this scheme.
Hi, my name is Daniel, and I will explain one of the program from Pencana. The program that I will explain is wage subsidy program. Wage subsidy program is a program that has been implemented by the government as one of the initiatives to help the citizen in order to ensure the sustainability of their well-being and also to ensure the economy will keep running even though the country was hit by COVID-19. This program is expected to be implemented from June until the end of September 2020. Actually, this program is already been implemented, which is on 3 September 2021, called Program Subsidi Upah 1.0 or PSU. But then it was been extended for until it become PSU 4.0. The government has set the amount for the subsidy, which is RM600 for each employees. The government has already set up the strategies on how to implement this program to ensure the burden of the people will be reduced and to help citizens, especially small and medium-sized enterprise (SME), to survive due to the COVID-19. One of the strategies that has been set by the government is by set some procedure for those who want to apply it. This is because to decide and determine whether the candidates are qualified and eligible enough to apply for this program or not. Let's go to how people want to apply for this program. For those who want to apply for this program, they need to fill in some form and document that are needed. The purpose of this form is to enable the government to do a check and choose whether they are eligible or not to apply for this program. They can find the field by visiting at prihatin.perkeso.government.my. Before they want to apply this program, there are few things that need to be taken into account. The first thing is the company want to apply for this program, employee or employer must enroll or add to SOCSO before 1st June 2021. The second thing is the business must has registered with the Companies Commission of Malaysia (SSM) or the local authority (PBT). Employer need to take note that the government only allow 500 employees per employer to claim for the subsidy. For employer who have been applied and received the subsidy previously, they still need to apply it again for this PSU 4.0. Since this program has been implemented from PSU 1.0 until PSU 5.0, there are some enhancements that has been made by the government to this program. The first enhancement is by allowed the employer to reduce the working hour and salary reduction up to maximum of 30% with the consent of the employees. The purpose of the reduce the working hour is so that the employer does not need to pay much since the employee is not working 5 days a week. The government also gave flexibility to employer to allow employees to receive this wage subsidy directly for those who have taken unpaid leave, with condition which the employee receive the subsidy directly, which for tourism sector, and for the forbidden sector that cannot be operated that has been listed through Movement Control Order (MCO). If the employer applies this program, there are some conditions that they must follow, which is for employer that choose to receive the subsidy must retain the employees at least for 6 months. Who will in charge for this program? The government has put a trust to Perkeso to in charge and handle this program. People who want to apply this subsidy can visit to prihatin.perkeso.government.my. Perkeso will filter the application form to choose and decide whether the person is eligible or not for this program. One of the examples of people that got this program is Mila Jirin. She received the subsidy since her business also affected by the COVID-19. She stated that the subsidy is really helped her to keep her business running and to pay her employee salary. Okay, now I'm going to explain about the challenge for this program. The first challenge is misusing the subsidy. According to Social Security Organization, SOCSO, there are at least 30 companies have abused wage subsidy program. SOCSO has received complaint at least 30 companies have made false claim. There are some companies that dare to falsifying documents for sake to get the subsidy. The company claimed that they had experienced a payoff cut of 50%. There are some companies that doing this thing for their own interest, not to help their employees. They apply it and get it, but not give it to their employees. And the last one from me is the second challenge, which is the company might have an issue guaranteeing wage subsidy under SME upgrade bundle. According to FFM President Tan Sri Sol Tai Lai, he said that however much the public authority had reacted to SME needs, a few conditions for the company to meet all requirements for the boost advantages might deliver it somewhat hard to guarantee the wage subsidy. He also said that the government has increased the limitation number eligible for the large company, which is from 100 to 200 per company. Since before this, the government has set limit for those who earn RM4,000 and below only can apply this program, it seems like some of company did not agree with this term due to their relevant reason. So they hope that this condition will be removed, said the president again. He is appealed the government to remove that condition because many companies under the Movement Control Order MCO still cannot seem to settle their monetary record for March 2020. This thing will make it hard for companies to apply for this program. That's all from me. I will pass to my friends to discuss about the other program.
Hi, my name is Ainaa Najwa binti Muhammad ZAMRI. I will continue the presentation with the strategies of implementation of the upskilling and reskilling program. One of the strategies that has been set by the government is by providing RM250 million matching fund to co-finance place and train initiative with Human Resource Development Fund. In this case, this initiative was taken on by the Human Resources Development Fund, which is an agency under the Ministry of Human Resources who is responsible for launching the Penjana Human Resources Development Fund initiative. So, this Penjana HRDF also was introduced by Datuk Sri M. Saravanan, who is the Human Resource Minister. Human Resources Development Fund (HRDF) is a government project aimed at continuing to enhance the nation's human capital, and it is a part of the country's short to medium-term economic recovery plan. So, through 5 Human Resources Development Fund strategic objectives, the Penjana HRDF initiative has developed a joint venture with 10 organizations to provide job business opportunity as well as training. So for the sake of the nation's well-being, HRDF has taken the initiative to assist Malaysians in honing their skills while simultaneously enhancing their prospect of finding work. For example, the Human Resources Development Fund (HRDF) has implemented one training funding program under this initiative, namely Industry Certification (INSET). So this program aims to improve local employees' abilities by allowing them to participate in a high value-added industry through training and certification courses that will help them advance their careers, while also allowing them to explore business prospects in a variety of industries. So HRDF intends to provide Malaysian workers with industry-certified expertise through this funding scheme. As a result, through the Human Resources Development HRDF initiative, there are over 20,000 job opportunities offered from the selected companies. So this proves that this Human Resources Development HRDF initiative is both necessary and beneficial in lowering the unemployment rate. So other than that, the selected companies such as National Technology Association of Malaysia, Tenaga Nasional, Breakfield as a College, Digital Economic Corporation of Malaysia, and 7-Eleven are among the first companies which provide job opportunities to the people. Other than that, the second strategy that has been set by the government is by providing a marketing representative training scheme to the people. So people will benefit from this training scheme where they will get RM800 per person by registering with the Securities Industry Development Corporation (SIDC). So SIDC collaborates with the industry to create, produce and implement training programs that enhance the standard of participants and support market growth through consultation and collaboration. The Marketing Representative Training Scheme (MRTS) is designed to provide displaced workers with the opportunities to reskill and improve their employability as they pursue marketing representative careers in the capital market. So candidates will receive up to RM800 to cover the cost of training, including the familiarization program for marketing representative (FPMR) and additional training days required upon registration as marketing representative under this project. So the candidates that are eligible for this training scheme are individuals or fresh graduates who are unable to find work owing to present economic condition, as well as applicants who were terminated from their company due to economic condition. In order to ensure the upskilling and reskilling program runs smoothly, the government might be faced some challenges during the implementation of this program. So one of the challenges that might be faced by the government is in terms of the budget of the implementation. So in this case, the government has provided RM2 billion fund to implement this upskilling and reskilling program. So this 2 billion fund is a huge number of amount, and if the program still continues in the future, then more funds will be needed in order to keep this program running smoothly. If the program still continues in the future, then it shows that the budget of the government might be increased from 2 billion to other higher value, as it will indirectly burden the government if they do not have enough funds, especially in the pandemic COVID-19. So it is because the budget of the government is not only divided for the economic recovery, but also needs to be divided into other aspects such as healthcare and economic sense, since it can help people survive during this pandemic. In this case, the budget of the government will be increased from time to time, as all of the training programs provided are free of charge, where the people who want to participate in that training program don't need to pay any cents. So for example, in the marketing representative training scheme, people no need to pay any cents to participate in that program, but they still get benefit, which they will get RM800 ringgit from the government by joining that program. So it shows that there is no written benefits in terms of monetary from the people to the government, as the people can join the program as free of charge, instead of only the government need to pay for them when they are joining that training program. The second challenge might come from the individual itself, especially the unemployed, where not all youth and unemployed workers apply and participate in these training programs that has been provided by the government. So according to the ZAMRI, who is the person who was participated in one of the training programs, namely Guru Penjana, has stated that not many people participated in that program, and it cost the agencies that have implemented that program to have fine to fill the vacancies in this training program. It shows that there are many youth and the unemployed who still do not take the opportunity to participate in the training programs. So it might be because the community, especially the youth and the unemployed out there, still do not know about the training program provided by the government, or due to lack of interest to participate in this training program. For example, Guru Penjana is one of the training programs that is implemented under the Department of the Ministry of Communication and Multimedia Malaysia, KKMM. So Guru Penjana is one of the training programs that focuses on the people who want to become a digital freelancer. So most of the people will follow their interest if they want to learn something. Therefore, the reason some people, especially the new graduates from the university, do not want to participate in a program like Guru Penjana is because they do not have a high interest, because the training program provided is different from the field that they are studying at the university level. So they think that they don't need a program that not related with their courses. Furthermore, as a result, they do not have the opportunity to work in any organization due to lack of skills, and indirectly it will further increase the number of unemployed in Malaysia.
According to the survey, 47.6% of the B40 population aged 50 and up will have at least one undiagnosed NCD from either the trio of hypertension, diabetes, or high cholesterol. As a result, Peka B40 emerged at an important time because it focuses on bantuan sara hidup recipients aged 40% and above who fall in Malaysia's bottom 40% of income level. In fact, there is no special registration required to join the Peka B40. So this scheme is supported by partners providers such as general practitioners, private laboratories, klinik kesihatan, and government hospitals in order to supplement the provisions of health screening through Peka B40. So by working together, it has increased the public access to primary health care services, specifically free health screenings under Peka B40. By implementing such a program, it is possible to raise up the health awareness among the public, particularly among the lower income group, who are always unconcerned about non-infectious disease. Since Peka B40 schemes emphasize more on the underprivileged household as their main target people, so the eligible beneficiaries can go for screening at either government health clinic, which is klinik kesihatan, or GP clinics. Once the screening is done, they are also eligible for health aid, completing cancer treatment incentive, and also transport incentive. Firstly, they need to go for the health screening process. So the doctor can perform health screening at any MOH clinic or private clinic that has registered with the PKB40. In urban areas, GPs and private laboratories would be more likely to perform the screening. Meanwhile, in the rural areas, klinik kesihatan will be the providers of the health screening, and the PKB40 scheme will be take part to the beneficiaries. Health screening includes taking a medical history, during which the practitioners will note family and individual ailments as well as risk factors. So they will also be subjected to a mental health screening followed by physical examinations. For example, clinical breast examination for the female recipients and clinical prostate examination for at-risk male recipients. So eventually they will be subjected to the blood and urine test as well. The recipients are eligible for health aids after completing the first process. They will be covered under these benefits of PKB40 scheme for medical equipment that is required for procedures or treatment and it is not subsidized in MOH hospitals. The recipients are given of maximum 20,000 ringgit in the form of acquired medical equipment. This benefit is only available to PKB40 recipients who are being treated in MOH hospitals, and the applications must be made on their behalf by MOH medical specialists. Furthermore, the third advantage of the PKB40 scheme is the completion of cancer treatment incentive. This benefit is designed to encourage cancer patients, particularly those in the early stage of treatment and disease, to follow through on their treatment plan as prescribed by MOH cancer specialists. Cancer patients who complete their treatments at MOH hospitals are awarded 1,000 ringgit. The payments of the incentive is divided into two parts, which the 300 ringgit is given when the beneficiary begins their cancer treatments and another 700 ringgit when their cancer treatment is completed. Last but not least, some recipients will receive transportation incentive through PKB40 programs. This transportation incentive is intended to alleviate the burdens of paying for transportations whenever recipients are required to travel to MOH hospitals for treatment. However, the government will not cover the entire of their journey's cost. This transportation cost incentive is only available to recipients who have received health aids or the completing cancer treatment incentive. So the maximum amount of assistance that they can receive is 500 ringgit for Peninsular Malaysia and 1,000 ringgit for East Malaysia. Regardless, the amount of incentive is determined by the distance between the hospital and the recipient's home at a predetermined rate. Thereby, the applications and proof of eligibility for the transportation incentive must be made by a medical social worker or a medical officer in charge of the patient's care. There have been a few challenges encountered during the implementations of this PKB40 program. For instance, the poor and underprivileged are frequently denied access to the information, whereby reaching all beneficiaries, particularly those in the greatest needs, is a current challenge for PKB40. This is due to the fact that the majority of information about PKB40 is advertised through multiple platforms, which require internet access to reach the information. Thereby, some underprivileged and impoverished people do not have a smartphone, televisions, or even internet access to learn about this program, and it is not going well or smoothly, especially for those who really need these kinds of benefits. According to the Protect Health Corporations, nearly 89% of those eligible for the PKB40 Health Care Protection Scheme did not have their health checked. Time constraints may have contributed to this low level of health screening because some of B40 beneficiaries, particularly those in urban areas, work multiple jobs to supplement their income. As a result, they may have no time to conduct the health screening. Apart from that, people's lack of health awareness could be one of the factors discouraging them from getting screened. This group includes the B40 who had no idea they had non-infectious diseases like diabetes, high cholesterol, high blood pressure, and so on. As a result, all these factors may pose difficulties for the authorities in implementing PKR B40 healthcare support.
So, Penjana is known as a strategic policy that is made by the government to help the people, the businesses, and the nation as a whole to bounce back from the economic downturn due to the pandemic of COVID-19. So, overall, we can say that this stimulus package managed to become the burden relief for the affected ones. It is a good initiative by the government as they continue to issue stimulus package to assist people to recover financially and to help them sustain their livelihood during this trial time. For the wage subsidy program, it is seen to give a breath to employers and employees to survive during this MCO, because we know that during the MCO, many of the industries need to shut down, many of the economic activities can't be open, so it gives relief to these industry players, to the workers, to the employers as well. As for the reskilling and upskilling program, it is a good move to find the new talent and preparing them to ensure that when the workers maintain and upgrade their skills so that when the economy recovers, they can be prepared to work again. And lastly, for the PKR B40 healthcare support is indeed an appropriate approach to ensure that all levels of society in Malaysia getting a desirable and proper healthcare assessment. With that being said, the presentation has now come to an end, so thank you for listening.